Dr. Mayank, I bring in all the wishes and greetings to you. And for scoring a topmost rank. And I got a message that you have scored expected rank of 31 in MCH plastic surgery. Am I right?
Yes, sir. That's right.
Excellent. Congratulations to you and for a fantastic achievement.
Thank you so much. So I am from Mumbai. I did my UG at BJ Medical College in Pune. And I did my surgery from St. Martha's. I did DNB in St. Martha's. Finished in September of last year, 5 months back. So I have been preparing since September onwards. So September, October, November, and December mainly. Those were 4 preparation months. And that's what it is, sir.
Great. And why plastic surgery?
So when we were doing my residency, I've seen a lot of cases of these finger amputations and those ones which we could manage ourselves in the emergency, and so it felt good. It felt like a good avenue and a good opportunity to learn and do more. Sir.
Okay. Can you share your methodology of preparation, your strategy of preparation, and you can share your experiences, so that will be useful for the students who are watching this video.
So I did my preparation in September first week of 2021, and I did only general surgery in the whole of September. In October, when we came to know the pattern has changed to part 60 and 40%, I started my plastic preparation in October first week. I finished my one reading of general surgery in September, one reading of plastic surgery in October, and November I took time to revise as much as I could of both. In December first week was the INI-CT, which and then followed by the interview. So in those 2 or 3 weeks, I was focusing mainly on plastic surgery because the interview process was more specialty oriented. Post that, I focused mainly on general surgery. So about maybe 2 weeks of December, I did plastic, and the next 2 weeks of the remaining 2 weeks of December, and I did general surgery. In the last 10 days, or the last 8-9 days, I was just revising whatever I had already gone through. So the material that I used, sir, was for plastic. I had read Graham and Smith. I read about 90% of the book as much as I could in 1 month, and obviously, in addition to that, I also added the notes or the videos which I saw on the Speed app regarding the plastic surgery preparation. So together, I had built up my notes, and I used that for my revision towards the end. For general surgery, we already had a base in terms of reading Bailey during the residency period. In addition to that, your videos about on Bailey, on the general pattern of Bailey, as well as the combined Sabiston videos, and whatever I could see the tables of both Bailey and Sabiston. So again, I compiled out those into notes, and then I just revised those notes towards the end. So I remember, sir, you had said you should do at least multiple revisions of plastic surgery and multiple revisions of general surgery. So I just tried to follow whatever you said, sir, in that sense. I did probably 3 and 3 of each, maybe 4 of plastic, because I was preparing for the INI-CT interview as well. So, but about 3 or 4 revisions I had done, so I could manage it by the time the exam came, and it was mostly and very much thank you to you for the and all of the faculty for the videos and the way the explanations were, and all those exams and the tests were very, very important. So, and yes, of course, doing the tests, including the AIMS tests and the INI tests, the NEET pattern tests, all those tests were very important. So compile all of them, put it into a book, and just kept on reading the book again and again towards the end of preparation. That's what I did.
So you made your notes on all the resources and you kept for revision, correct? Yes.
Compiled it, yes.
Compiled. Good. And so I could see through how focused you were, and to reach this destiny. Very, very, very meticulous and very focused, and you have not left any stone unturned. Meticulously, whatever to be utilized in the app, you have done appropriately without failing, and you have made it. And great. And the well-disciplined preparation always yields results.
That's completely true, sir. Very, very true. It also helps if the teacher is good, sir. Just like how you and the faculty were in terms of the way you taught and what are the points which are important. Having a good mentor is as important as the focus and effort that we put, and which I think you and the faculty provided very, very well, sir. So, I mean, my thanks to you as well, sir. You all as well, sir.
See, my job is to kind of push students, keep moving, keep going, so that
Including the time when you said how many questions to attempt, try to attempt all general surgery questions, and if you want to leave, only leave in your specialty. I followed those also to the T, sir. I have attempted 40 of 40 in general surgery. I have done 55 of 60 in plastic surgery. So 95 is what I attempted. So I tried to follow whatever you told me to do, sir. And
so it's all worked good, and that's important. So, what is the message that you want to leave to your juniors and friends? Message from Dr. Mayank to his juniors and friends.
so I think the most important thing, irrespective of field or whatever, is that the result does not matter at all. It is the least of the botherations. What matters is the process, how you approach your subject, how you're able to put a focus, and how you need to know what all you need to do. You need to read your textbooks, you need to read the exam papers, you need to revise them again. There's no point reading this once. None of us, I mean, not most of us can't remember it reading only once. And so reading it, a good revision, a good reading, a good revision, and solving papers. That is the process which needs to be followed. If the process is followed, the results have to follow. There is no other way. If you have done everything correctly, the results can't be wrong at the end. So, I mean, it was one thing that my parents taught me long back, but I think I only followed it now after so many years, that the result doesn't matter. What matters is how the effort that you put, dedication and the focus, and the more importantly, the process that you follow. If you have not done reading, or if you have not done exams, or if you have not done, then I mean, it doesn't translate into a rank automatically. What translates into a result is the process. If you can focus on the process, I think that is most important part. The results will anyway automatically come. Specifically, if I go into topic-wise, if preparing for the INI, which is still going to be the plastic, the specialty plus the general pattern, at least in plastic, I would recommend to read Grab and Smith, sir, because we don't like unlike GI and urology and other subjects which we see a lot more cases and read a lot more during our residency. It's the same. No, it's not the same for plastic surgery. So having some kind of base is very important, at least the concepts. Because this time's NEET exam was very, I mean, unexpectedly, I think I had good questions, sir. They were very concept-based questions. And if you are read, you would know it. If you are not read, there's no way you could guess the answer. So reading Gavin Smith once helped me. A lot of people are not able to do it, but doing that along with the videos really helped me a lot. Your what you given the tests, the NEET and the INI tests, solving them once, twice, going through your mistakes, making a note of your mistakes, making on the points. The main job is the last 10 days 10 days before the exam, everything should be easy. You should just skip through pages and see. But that starts in the beginning. You can't end up having everything in the end, towards the end, and you can't see 100 books at the end when the last 10 days come. So having everything concise into one book, but that starts with doing Grab and Smith, reading it, making your notes, seeing your videos, making your notes, doing papers, making your notes, and then revising them. For general surgery, sir, I think Bailey is pretty sufficient enough. But this time's questions were more at least in I don't know about the other ones, but the plastic one was more pediatric surgery oriented. The questions. Most of them, I'm also not sure where I've seen it or where I read it. Probably whatever comes from the residency time that. But basically, sir, reading Bailey is a very good medium for getting at least basic knowledge, and that cannot be ignored. Like how Grab and Smith is for plastic, I think I would say Bailey is for this, and obviously the Sabiston, even the volume is a lot. Going through tables also of that will help. So going through your videos, whichever videos you have made, especially the Bailey videos, where you also teach the candidate how to pick up on questions, how this line can become a question, or how that line, or how changing one option and this can change the whole answer to it. Focusing on those points, because now everyone has the same amount of knowledge at this moment. What changes is how you pick up on those changes on the question options, and when one sentence can give you 4 other questions. So that has to be focused on. Focusing on that, making notes, and then revising. I mean, once you make good notes, the only thing left to do is keep on going through it like a Bible or like a Bhagavad Gita, and just keep on finishing it towards the end. That's the main advice. The most important thing is forget the result, just focus on the process. The results have to follow.
Great. Now, to reach this stage of your career and your destiny of plastic surgery, whom all you want to thank? And please do so.
Sir, thank you so much for that question, for opportunity, sir. My parents have to be the biggest support that I have ever got in my life, sir. From whatever age, whatever young age I was, they've always been behind me they always supported me, whatever. There's never been do this, do that, nothing. Whatever you want to do, you do. We're there to take care of you and they support in whatever way. So my parents are the biggest thanks in this, sir. I really want to thank my parents, my grandparents, my friends, all of them have been through my juniors in residency, my seniors, all of them who have been worked together, not only in MBBS but also in residency times. All my faculty during my residency times, as well as you, sir. Coming on to speed, and because before this, I did not know about you or the way you taught all those things. But now I wonder that if I known much before, I would have started much before than in the last 4 5 months. You have really given a lot of focus or help me focus in what to do and how to do it, how to pick up questions at least. That's very, very important. So I'm thankful for that. For your efforts, the amount of efforts that you have put personally, as well as the faculties. I mean, every has their own good things, but then they have taught so well and they made such an interesting field. It's a new thing, so but they made it more interesting and more. I want to know more about it. They made it like that, and the effort that you have put. But so thanks to all of you, sir. But I think the main would be to my parents because without them, this wouldn't be possible at all, sir.
Great. Doctor, bring in all the wishes to you, greetings to you for a great career in plastic surgery ahead and as to be a great contributor to the specialty of plastic surgery and also to serve thousands and lakhs and millions of patients. They will be more happy to receive your services from your hands. And for all that happen in future, all our best wishes is with you, and keep going, and whatever you want to achieve from further on, yes, the world is open to you, and go ahead and be happy. Best wishes to you and to your family and to your friends and relatives. Thank you.